7 medications that could increase your risk of dementia. Now, dementia, the medical term for memory loss, affects around 50 million people worldwide. It's a chronic, irreversible condition that leads to poor quality of life, high dependency, increased mortality, and massive healthcare costs across the globe. And here's something you might not know. While aging is the biggest risk factor for dementia, it's not the only one. Other factors, like the medications you take, can also play a huge role, even causing early-onset dementia in younger people. Subscribe and share this video with your friends so we can make the world a better and healthier place for all of us. By 2050, it's estimated that more than 130 million people around the world will suffer from dementia. So let's get into it, starting with a group of medications you might not expect. First up, anticholinergics. These drugs block a chemical in your body called acetylcholine, which helps transmit signals between your nerve cells and your muscles. Because they act mainly on your central nervous system, anticholinergics can affect memory, emotions, movement, even learning. Interestingly, people with Alzheimer's disease often have lower levels of acetylcholine. But, just to be clear, low acetylcholine alone doesn't explain all the symptoms of dementia. It's just part of a much bigger, complex puzzle. Some common anticholinergics include allergy meds like diphenhydramine and chlorpheniramine, IBS treatments like dicyclomine and trimebutine, and bladder control meds like darafenicin and oxybutynin. A big study out of the University of Nottingham looked at nearly 300,000 people and found that anticholinergic use increased dementia risk by about 50%, regardless of other factors. This effect was seen in both men and women, and the risk was especially high for people who took these meds daily for 3 years or more. Next, we have proton pump inhibitors, or PPIs, the meds often called stomach protectors. Drugs like omeprazole, pantoprazole, and esomeprazole fall into this group. Studies show that PPIs might contribute to the buildup of beta-amyloid proteins in the brain, which are heavily linked to Alzheimer's disease. Plus, these meds reduce your body's absorption of vitamin B12, and low B12 levels are another risk factor for dementia. Painkillers are next, especially opioids. While they're great for managing pain, opioids can mess with your brain, affecting sleep, mood, emotions, and, over time, memory. Chronic use has been linked to an increased risk of dementia. There's also been some discussion about nonsteroidal anti-inflammatory drugs, like ibuprofen and diclofenac, but the evidence there isn't as strong yet. Moving on to benzodiazepines, drugs like diazepam, clonazepam, and bromazepam. These are commonly prescribed for anxiety, insomnia, and depression. But long-term use, especially for over a year, can raise dementia risk by about 50%. They can also cause other problems like drowsiness, falls, dependency, and cognitive decline, particularly in older adults. Another group, anticonvulsants. These include meds like gabapentin, carbamazepine, lamotrigine, and topiramate, often used for epilepsy, bipolar disorder, or chronic nerve pain. Long-term use can alter neurotransmitter levels in the brain, possibly affecting areas that are sensitive to memory and cognitive function. Up next, tricyclic antidepressants. Although they're older medications, they're still used today for depression, OCD, anxiety, and even nerve pain. But they reduce acetylcholine levels too, and with long-term use, they could increase dementia risk. While there are newer alternatives with fewer side effects, some patients still rely on tricyclics. So, again, it's about balancing benefits and risks. And now, heart medications. Diuretics like hydrochlorothiazide, furosemide, and spironolactone have been linked to a 50% higher risk of dementia in some studies. Also, long-term use of beta blockers showed a slight increase in dementia risk. However, it's worth noting, these studies often relied on post-mortem diagnoses, and sometimes dementia symptoms overlap with other conditions. Still, it's an important association to keep an eye on. Last but not least, antipsychotics. They're vital for treating conditions like schizophrenia and bipolar disorder, but using them long-term, especially in elderly patients, can increase the risk of dementia and harm other organs too, like the heart, liver, and lungs. So what does this all mean? Well, Medications can definitely play a role in dementia risk, especially if you're older or have a family history of brain diseases. That said, just because a medication might increase risk doesn't mean you should stop taking it on your own. Always, always talk to your doctor before making any changes. Subscribe and share this video with your friends so we can make the world a better and healthier place for all of us. And remember, it's super important to tell your healthcare provider about everything you're taking, even natural supplements, so they can manage your risk the right way. If you made it this far and you learned something new today, drop this phrase in the comments: Jesus, doctor of doctors. Because even the hardest times, whether physical, emotional, or spiritual, faith reminds us that there's always hope. Healing is possible, and with love, compassion, and faith, we can overcome more than we ever imagined.